Meditate here. Let's talk about the anatomy of the heart. In this video, we're first going to look at how the blood circulates in the body. After that, we're going to cover the different external structures you'll find on the surface of the heart. Then we're going to open up the heart and go through the internal structures of each chamber, which include the right and the left atrium and the right and the left ventricles. And then the circulation. So here is the anterior view of the thorax, right? If you remove the sternum and the rib cartilage, you will be able to see the heart right here. The heart lies between the plavida of the lungs in an area called the mediastinum. So before we talk about the heart's anatomy, I want to first take you through the general layout of the blood circulation in the body. And once you understand the concept of how the blood circulates in the body, you will be able to learn the anatomy of the heart much more efficiently. Throughout your body, your blood will either be deoxygenated, meaning it lacks oxygen, or oxygenated. We're going to start with the hearts receiving the deoxygenated blood from the body. So the body has collected all the oxygen and it's sending the blood back towards the heart. So the blood will enter the heart through the superior and the inferior vena cava into the first chamber, which is the right atrium. So the color blue will represent deoxygenated blood. The blood is then going to go through the tricuspid valve into the right ventricle. The right ventricle is then going to pump the blood through the pulmonary valve and then into the pulmonary artery, which is then going to pump the blood into the lungs to exchange carbon dioxide with oxygen. And when this is done, blood will come back into the heart with oxygen. So the blood is oxygenated now, represented in red. And they will come back through the pulmonary veins into the left atrium. The circulation where the blood goes from the heart to the lungs and then back is called the pulmonary circulation, or sometimes also referred to as a small circulation, since it's a circuit on its own. The pulmonary circulation is a circuit on its own. Now, the left atrium will send the blood through the bicuspid valve towards the left ventricle, and when the left ventricle pumps, it will send the blood through the aortic valve, and then where it's eventually going to end up in the aorta, and then back into the body again. So the circulation in which the left ventricle pumps the blood to the body and the body then sends the blood back to the heart again is called the systemic circulation, or the major circulation. And notice that in this pulmonary circulation, arteries contain blood without oxygen and veins contain blood with oxygen, opposite to the systemic circulation, where arteries contain blood with oxygen and veins contain blood without oxygen. Awesome. Let's finally start with the actual anatomy. So if you turn this picture to the side, you will be able to see the pointy end called the apex of the heart, which is directed forward and downward to the left. And then if we turn the heart around and look at the backside, we can see the heart's base, or basis cordis, directed backwards and then a little to the right. The base is connected with the great vessels you see here. So an apex and a base. Now the heart has three surfaces. It has a pulmonary surface towards the left lung, as you see here. And then we have the sternocostal surface, directed towards the inner surface of the ribs and the perfectly drawn sternum. And then we have the diaphragmatic surface towards the central tendinous part of the diaphragm. Keep in mind that some sources say there are 5 surfaces on the heart, counting the right pulmonary surface and the base as 2 other surfaces. So sources may vary depending on which source you're studying from. Let's now take a closer look at the surface. The only margin that the heart has is the right margin on the right border, which lies between the sternocostal surface and the diaphragmatic surface. One cool thing in knowing the external structures of the heart is that you're actually able to know exactly where the inner chambers are based on the external structures, and I'll show you how. First, we have the coronary sulcus, which separates the ventricles from the atria. So this sulcus goes around, and here we see the posterior aspect of the heart again. The coronary sulcus goes all the way around like this to separate the right and the left atrium from the right and the left ventricles. Another sulcus you will see is the anterior interventricular sulcus. This sulcus continues posteriorly as the posterior interventricular sulcus, and this sulcus separates the right ventricle from the left ventricle externally. Now, let's take the heart and give it a good slice and then remove the upper half and look at it from this perspective. You will see this. So we have this wall called the septum of the heart, separating the right side of the heart from the left side of the heart. And it's crucial to have this wall because remember, the right side of the heart contains blood without oxygen, while the left side of the heart contains blood with oxygen. And you really don't want to mix those up, so it's good to have this wall. Alright, so we divide this wall into two parts. We have the interventricular septum, separating the two ventricles, and we have the interatrial septum, separating the two atria. Now, the interventricular septum can be further subdivided into two parts. We have the muscularis part down here, since in this area the muscles are packed together, and up here is the membranous part, since this is the area where the valves are. So that's mainly the general structures we have on the external heart. Now let's look detailed into the different chambers, and we will start with the right atrium. So here we see the anterior lateral view of the heart, and the right atrium is located right about here, inside in this area. Now, in order to understand the full anatomy of the right atrium, we need to go through all the 6 walls of it. So let's work our way through this list, starting with the anterior wall. So the anterior wall is right here, and it consists of the right auricle. The right auricle is a small muscle pouch, and this is where the anterior and the lateral wall has something in common. Both have this muscle layer called the pectinate muscle. As you see here, the pectinate muscle consists of striated muscle fibers which help contract the right atrium to push the blood further into the right ventricle. So that's the anterior and the lateral walls, so let's check them. Now let's go ahead and remove the lateral and the anterior wall to look inside the right atrium. Here we see a little bit of the pectinate muscle we mentioned earlier. Now, if you look at the superior wall has an opening for the superior vena cava, so that the blood can get into the right atrium. So that's mainly the superior wall. On the posterior wall, we can find the opening for the inferior vena cava. Remember, the heart is tilted forward, right? And because it's tilted forward, the inferior vena cava becomes a part of the posterior wall. Another thing you will find in the posterior wall is, anteriorly you have the rough pectinate muscle, right? But posteriorly, between the opening of the superior and the inferior vena cava, we have a wall called the sinus of vena cava, or sinus venorum. This had a function during embryonic development, but now it forms the area for the sinoatrial node for the conducting system. Now there's a line that separates the pectinate muscle and the sinus venorum, and if you look at the outside of the lateral wall again, we have a crest called the terminal crest that separates the transition between the pectinate muscle and the sinus venorum. So that's mainly how we distinguish where the sinus venorum is and where the pectinate muscles end. On the posterior wall, we can also see a valve, and this valve is called the valve for the inferior vena cava. It's considered an embryonic valve that during fetal life, the blood went directly from the inferior vena cava to a hole on the medial wall, which is now called the oval fossa. The blood went directly from the right atrium to the left atrium, since the fetus doesn't need the pulmonary circulation because they get their oxygen through the placenta. But in adults, the valve remains, it's still there, but it remains as a small fold on the posterior medial wall, which is the ridge you see here. So that is the posterior wall. Now let's do the medial wall. Remember, the medial wall is made up of the septum between the right and the left atria, called the interatrial septum. On this septum, that's where you will find the oval fossa, and around the oval fossa, you will see that it's bordered by an elevation called the border of the oval fossa, which is also referred to as the limbus of oval fossa. Another thing you will find here is an opening for the coronary sinus, which lies between the medial and the posterior wall. This is the opening for the main vein draining the blood from the heart. And this opening is guarded by a valve called the valve for the coronary sinus, which is really just a fold covering it. So on the medial wall of the heart, you will also find very small openings returning blood directly from the layers of the heart's wall, called the opening of the smallest cardiac veins. So that's mainly the structures on the medial wall. Now lastly, we have an inferior wall. And to see this one, we need to slightly change the angle, as you see here. Now we are able to see an opening called the right atrioventricular orifice, or opening. That's the opening between the right atrium and the right ventricle. And this opening is guarded by a tricuspid valve, which prevents the backflow of blood. and it's called the tricuspid valve because it has 3 cusps or 3 leaflets. So if you zoom in on it, you will see 3 cusps right here. And just a quick way to remember that the tricuspid valve lies on the right side. The name tricuspid valve has the letters RI, which resembles right. So the tricuspid valve is on the right side, and it consists of the anterior, posterior, and the septal cusp. So that is the inferior wall. Now let's look at the right ventricle. So the right ventricle has a triangular shape, as you see here. Now on the base of the right ventricle, you will find the right atrioventricular opening, which is the opening between the right atrium and the right ventricle. Another opening you will find is the opening for the pulmonary trunk. Now if you look within the actual ventricle, you will see a rough inner layer, right? And most of that rough inner layer is called trabecula carnea. The trabecula are essential because they prevent the blood from swirling around, because remember, when blood enters the heart, it enters with a very high velocity, and by having this rough inner layer, you actually prevent the blood from getting air bubbles as they reach a sudden break when they get into the ventricles. And these air bubbles can be lethal because they can cause a potential air embolism. Another thing you will find here are the papillary muscles, just like in the atria. Their function is connected to the tricuspid valve. So this valve, again, it guards the right atrioventricular opening, and it has 3 cusps or 3 leaflets, as I mentioned earlier. It has the anterior cusp right here, it has a posterior cusp, and it has a septal cusp towards the ventricular septum. That's the septum that separates the right and the left ventricles. These cusps, including all other cusps, are formed by a double layer of endocardium, and we'll talk about that in the next video, but keep that in mind. The opening is also surrounded by a fibrous ring that supports the valves and function as an attachment point for these 3 cusps. So each cusp has 3 margins. One margin of each cusp is attached to the fibrous ring, and the other 2 margins are attached to the tendinous cords, which are cords of fibers that attach the cusps to the papillary muscles, which control the valve's opening and closure. And then up here we have something called the pulmonary valve, which have 3 semilunar cusps. And these, just like the tricuspid valve, are formed by a double layer of endocardium. And if you're unsure what endocardium is, that's no problem. For now, just know that the endocardium forms these cusps. The pulmonary valve also has a fibrous ring around where the base of the semilunar cusps are attached to, while the free margin are directed upwards into the pulmonary artery, as you see here. The pulmonary cusps have a free margin, as you see here, so they differ from the tricuspid valve. There's a nodule in the center of the free border called the nodules of the semilunar valve, which provides a tight closure to the valve. And here we can see another structure between the semilunar valves and the walls of the pulmonary artery. We can see the sinuses, called the sinus of the pulmonary trunk. The pulmonary trunk is just another name for the pulmonary artery, and this sinus is basically just a space here that the cusps form once they bend upwards. Here's another picture just to visualize it. You see the 3 semilunar cusps down here, and you have a nodule in the middle which help with the tight closure, and the spaces or the depression behind is called the pulmonary sinus. So that was the anatomy of the right side of the heart. Here again, you get the blood coming from the body into the right atrium. From the right atrium, blood goes through the tricuspid valve, as you see here, into the right ventricle, and then the blood continues upwards through the pulmonary valve into the pulmonary artery. And the pulmonary artery is going to lead the blood into the lungs, where the blood is now going to get oxygenated. And then that oxygenated blood goes into the left atrium. So now, let's have a look at the walls of the left atrium. Remember, the left atrium lies on the other side of the right atrium. But let's repeat something first. So here you see the anterior view of the heart, where you'll be able to see the right atrium again. Remember, the anterior wall of the right atrium consists of the right auricle, but if you turn the heart so that we're looking at the posterior lateral surface, we can see that the anterior wall is made up of the left auricle, which remember is a muscle pouch containing the pectinate muscle. And back here, we can find 4 blood vessels on the posterior wall, where oxygenated blood from the lungs comes in. And these blood vessels are called pulmonary veins. So the posterior wall of the left atrium has 4 openings. and these openings are called the openings of the pulmonary veins. Alright, so now let's open up the walls to look at the inside. You can see that the medial wall is the interatrial septum, which, as you know, separates both atria. And then anteriorly, you will find the opening which leads into the left ventricle, the left atrioventricular opening. And this opening is guarded by a valve called the bicuspid valve, or you can also use the term mitral valve. So that was all for the left atrium. Let's now do the left ventricle. So here we see the left ventricle with the mitral valve. And if we tilt it a little bit in this direction, we will see one more valve. So let's go ahead and talk about the base of the left ventricle now. From these two angles, we're able to see the left atrioventricular opening, where the blood from the left atrium comes in, and the aortic opening, which leads into the aorta. Let's now do the left atrioventricular opening first, and then do the aortic opening. So here we see the left atrioventricular opening again, and it's guarded by the bicuspid valve, or the mitral valve. And just like the other valves, it has a fibrous ring around that the cusps are attached to. Now, since it's called the bicuspid valve, it means that this valve consists of two leaflets. One is called the anterior cusp, and the other one is called the posterior cusp. But regardless of the names, there are actually several small cusps located between them. So here we have the bicuspid valve, and here's the anterior cusp, and here's the posterior cusp. And these small cusps right here, these are called the commissural cusps, which are very small cusps that support the valve. Now, if you look closely at the surface of the lateral ventricle, you will notice that it has more or less the same structures as the right ventricle. There is a trabecula carnea for the blood flow, and here we have the papillary muscles, which remember are attached to the tendinous cord. So the tendinous cord binds the cusps of the mitral valve onto the papillary muscles. So when the papillary muscles contract, they open up the mitral valve. Now let's turn the heart in this direction so that we can see the aortic opening. This region that leads into the aortic opening is called the aortic vestibule inside the left ventricle. Here we will find three semilunar cusps, but this time they're called the right semilunar cusp, posterior semilunar cusp, and the left semilunar cusp. So right, posterior, left. They also have a nodule that helps close the valve tightly, and three aortic sinuses here on the top, which remember are just depressions formed by the semilunar valve. Awesome. So now we have gone through the pulmonary circulation, which pumps oxygenated blood into the left atrium. The left atrium will now pump the blood through the bicuspid valve into the left ventricle, which will pump blood through the aortic valve into the aorta, and then to the rest of the body. I really hope you found this video helpful. If it did, please put a like, comment, share, whatever you find convenient to you.